13 people who came in contact with the country's first UK variant coronavirus case have tested positive for COVID-19. Our correspondent Rex Remigio is reporting to us live from Mandaluyong City. Rex, what does it mean if they tested positive for COVID-19? What are the chances that they were infected with the UK variant?
It doesn't necessarily follow that they will acquire the UK variant just because they came in contact with the person that had the same variant. Another swab test was done and the samples were sent to the Philippine Genome Center. Those samples will undergo a whole genome sequencing to determine the presence of the variant. They will also use the so-called cycle threshold value or CT value. If the CT value is more than 30, it means low viral load. These are inversely related. If the value is less than 30, it means high viral load and higher chance of presence of the UK variant. Preliminary analysis, however, shows all samples have low viral load. Health Undersecretary Maria Rosario Vergeire says the full results will be released Thursday evening or Friday morning. On the 13 persons who test COVID-19 positive, 8 are Filipino passengers in the same Emirates flight as that of the first Filipino-UK variant case or the so-called index case. They arrived in the country from Dubai last January 7 and were immediately tested and quarantined. They are now in stable condition and isolated while waiting for results of their next swab test. The other 5 close contacts of the index case, meanwhile, are his girlfriend and 2 other co-passengers who all initially tested negative upon arrival. They underwent another swab test which yielded positive results.
Ngayon, bakit ba nagkakaroon nitong pagdating ay negative tapos biglang nag-positive? Maraming factors, Greg. Maaring yung timing ng pagtetest, no? Maaring nung dumating yung tao, for example, galing siya sa ibang bansa, dumating siya, negative siya dito, maaring nag-i-incubate pa lang sa kanya, no? Hindi pa nag-uumpisa yung sakit at nandun pa lang sa kanyang sistema. Kaya importante talaga yung timing ng mga test natin. Kaya gusto natin, pag dadating ang isang tao, at least 5th day, kasi that's the most timely, no, na makakakuha tayo. If ever may sakit sila, lalabas dyan talaga kung positive sila.
The other case is his mother and a healthcare worker from Quezon City who attended to the index case. We have yet to know, however, how his mother was infected with COVID-19 since the index case was immediately isolated when he arrived in the country. The index case, meanwhile, is currently recovering and in stable condition. 153 out of 159 passengers of the same flight are now isolated. The DOH was also able to contact another 2 this morning. They have yet to contact the remaining 4. The DOH is urging them to reach out to health authorities as soon as possible. Back to you.
Rex, let's talk about vaccine procurement. Will Sinovac push through with clinical trials here in the country, even if it's also applying for emergency use authorization?
Yes, Sinovac will go on with the clinical trials of its vaccine in the country. The DOH, however, did not disclose on which group of people they will do the trials. Vergeire did not mention any age group or where Sinovac will conduct the trials. Vergeire says they just want to know for now what will be its impact on the subjects. Pia.
Rex, we understand there is not enough evidence on whether vaccinations will stop the transmission of COVID-19. What is the health department's warning to the public?
These vaccines are not magic pills against COVID-19. It doesn't mean you can just throw your mask away once you're vaccinated. The DOH is always urging the public to follow the health standards even when they're already vaccinated. You should still wear your mask, physically distance yourself from others, and always wash your hands often. Vergeire says there's still not enough evidence on how long the vaccines will be effective once these enter your body. What's only certain for now, Vergeire says, vaccines can lower chances of you being infected with the virus. Back to you.
Rex Remigio there reporting, and the